Okay, so welcome everyone to a new video of pediatrics, that is Pompe disease. That is basically a type of glycogen storage disease type 2. Okay, without wasting time, let's get started. A very important topic, and classical MCQs are asked from this much information only. And yeah, that's all. So let's get started. GSD2, that is a glycogen storage disease type 2. What happens here is what is the pathophysiology here is accumulation of glycogen in the lysosomes because of the absence of enzyme. What enzyme we'll talk about in just a second. Accumulation of glycogen in the lysosomes that will cause massive vacuolization. Vacuole hoy na, the air filled vesicles type vacuolization would increase, and that would basically massive vacuolization in the muscle fiber. Okay, so massive vacuolization in the muscle fiber, and which leads to the symptoms that are classical in this Pompe disease, and PA is positive. Okay, so vacuolization hota hai because of accumulation of glycogen. What enzyme is deficient here? So we have to remember, this should be on your tip of tongues, that is acid alpha-glucosidase. Very important. You don't have to mess up here. Glycogenate glucosidase, ऐसा कुछ गलती नहीं होनी चाहिए. Acid alpha-glucosidase, GAA, acid alpha-glucosidase. Speak with me. Acid alpha-glucosidase. Okay, acid alpha-glucosidase. And this disease is also known as acid maltase deficiency. Okay, this disease is the other name of this disease. It's acid maltase deficiency. The enzyme deficient is acid alpha-glucosidase. Okay, GAA. Lysosomal alpha-1,4 glucosidase. Okay, this we have to remember, that the a group of enzymes is glucosidase. Okay, glucosidase. Okay, this is important. Now the classical MCQ ask multiple time, that is baby is given to you the symptoms with hypotonia, floppy baby, with hypertrophic cardiomyopathy, that is heart symptoms are given. Mostly they mention cardiomyopathy to make it easier for us. Hypotonia, floppy baby, loss of tone in the baby, hypertrophic cardiomyopathy, along with macroglossia, that is big tongue. Okay, CK is increase in liver enzymes that are not specific, so you don't have to remember that extra. Very large QRS complex in the ECG is seen. These things, the circles ones, you have to remember: macroglossia, hypotonia, and hypertrophic cardiomyopathy ka patient ho, that is classical for Pompe disease, that is GSD2, and the enzyme deficiency is acid alpha-glucosidase. Okay, glucosidase. Now feeding difficulty obviously would be there in the patient. Now what is the management of this patient? Iska treatment kya hai? So we have enzyme replacement therapy of this enzyme that is deficient, that is that is okay, we have just added glucosidase, Alglucosidase alpha, and also known as myozyme. Okay, that is also known as myozyme. So we have to remember this only, myozyme. Okay, just remember myozyme along with Alglucosidase. What is deficient? We are just giving recombinantly, right? So glucosidase. And also you have to remember, in GSD1 there is a presence of lots of hypoglycemia, but here there is no hypoglycemia. Okay, I have written the last line, that is no hypoglycemia. Thank you so much for listening to me. Here is that's everything you know about Pompe disease.